Stephen Barberly, the number of coronavirus cases is continuing to increase, but that's no surprise, given that our testing capacity is also increasing and coronavirus is still prevalent in our community. So we go beyond the numbers to help explain some trends that are occurring and why that's the case.
There are now nearly 9,000 confirmed coronavirus cases in San Diego County. The actual number is still likely higher because not everyone is tested, but our testing capacity is increasing every week the pandemic continues. Monday to Monday, Encinitas saw cases jump more than any other city, up more than 33%. It's notable because it was the first city to have a reopened protest. Organizers then pointed out Encinitas went almost a month without adding any cases in April. The largest number of cases continues to come out of South Bay communities. Leaders correctly point out it doesn't actually show where residents are getting infected. Many are frontline workers, including some who work in restaurants that now allow dine-in eating or businesses with in-store shopping. Hospital officials stress they're monitoring the percentage of positive cases relative to the number of tests performed as an indicator of progress. That number spiked above 4% this weekend for the first time in about a month. That coincides with the biggest reopenings, but the county says tracers found more cases are actually originating at gatherings in people's homes, not businesses.
We are advising against it because when you have individuals outside of your households come together, there is the increased risk for spreading COVID-19.
Health officials continue monitoring the number of available hospital beds and ICU capacity to handle any potential surge and say cases will still rise. Scripps Health stopped accepting patients from other counties to ensure there's enough space for San Diegans and avoid triggering a change in the health order.
We cannot rest on our laurels, and we have to be constantly on top of what's going on with the number of cases, hospitalizations, outbreaks as well.
The full effects of the continued reopening and ongoing protests takes about 2 to 3 weeks to show up in the data. That's because the incubation period for coronavirus is up to 14 days, and it takes time for some of those test results to get returned into the county. Every time something changes, it essentially resets the clock, which is why it requires us to continually watch the numbers. Stephen Barberly,